A Centre County woman never expected to hear the words cancer. Becky Blunt has learned how to battle this diagnosis. Here's Becky's journey. Becky and Dan Blunt are retired. They have some much needed time now, and it's time focused on Becky's health. Becky shares her journey that began 12 years ago.
Well, I was having severe back pain, and my mother had a heart attack, and hers started with severe back pain. So I decided I would get it checked out, and when I did, it wasn't my heart, but it did turn out to be a neoplasm in my lung, which was completely devastating to me.
And it's just like your whole world dissolves. You just can't believe in just a second that everything goes from being fairly normal and very, I can handle this, to, oh my God, what are we getting ourselves into?
And of course, you immediately think, when you hear cancer or think cancer, it's a death sentence, that's it, But I had early detection, so that was the one thing in my favor at that time.
Surgeons removed the right upper lobe of Becky's lung.
The doctor said we got it all, and everything was going back to normal, and we thought, hey, we can go ahead with our plans.
For 12 years, doctors monitored Becky.
At least every 6 months, I would have either a CT scan or a PET scan. And they would watch to make sure that there was no highlighting areas or that there was nothing new there.
The scans looked good until earlier this year.
They saw one little area, so they started to watch it closer and closer.
Then they said, well, there's one that's had some growth, and it looks different.
And at that time, when he said that they were going to do a biopsy, I decided that I would reach out to the Hershey doctors.
She underwent sort of bronchoscopic biopsy, which determined the soft tissue growth to be lung adenocarcinoma.
He was very uplifting to me that it's not going to be a problem to take care of.
Dr. Ma recommended chemotherapy and radiation.
So essentially it's a combination chemotherapy as well as at the same time daily radiation up to the dose regimen intensity to allow curative intent of treatment to eradicate the lung cancer that have been identified.
What's the best thing of all is that we came up between radiology, oncology, and pulmonary oncology, a game plan.
And I was under radiation every day for 5 days a week and chemotherapy once a week.
Becky recently finished that treatment and it was successful.
It shows some tumor shrinkage with no other new disease evidence as well.
We're ecstatic. The fact that the radiation did show that it did shrink the tumor.
Now Becky moves on to the next phase of treatment.
They determined they wanted to do some immune therapy on me. It's a new treatment. It's just been recently FDA approved, I found out.
The principles of cancer immunotherapy is based on summoning or sort of awakening patients' own immune system to fight the cancer.
With the guidance from Dr. Ma, it's a battle that Becky and Dan are ready to fight again.
So we're in the journey together. I always try to earn their trust to see me as their coach, the good coach. They're the one who's in the race. I try to offer them hope.
Hope is the biggest thing we have again now. Because we're seeing it work, I have hope for years with her, not just months.
I'm ready to start a new chapter. I'm ready to start the immune therapy, and I'm ready to get back into doing what normal retired people do, which is travel. I want to travel.
She is a miracle. They found her cancers both early and treatable. She's my miracle, but I still push her because I want her to be with me forever.